Hey everyone, so I'm going to go over urinary tract anatomy today. Mostly it's going to be the kidneys, but also the bladder as well. So, first off, this is going to be the kidney. So, you have two of them, a right and a left. If you look kind of on this outer section, kind of right here, this outer part is called the fibrous capsule. Now, the fibrous capsule is kind of in the name that it's connecting and kind of holding together all of the internal parts of the kidney. So this is going to be kind of the container that it's in. This outer portion right here, where all these white dots are and kind of coming all around, so this outer lighter portion is going to be called the renal cortex. So kind of comes down, this is the renal cortex as well, and then kind of coming up and around. This inner portion, which is darker, and we're going to talk about specific parts of them coming up, this is your renal medulla. So the middle part is the medulla, the outer part is the cortex here. So these little triangular sections right here, this kind of little fan looking part, and there's one here, there's one here, down here. Sorry, getting used to the camera. So each one of these is called a renal pyramid. So you can think of it as a little triangle or a little fan. So those are going to be each part of the medulla. At the tip of the pyramid, so on tip of the renal pyramid is going to be called the renal papilla. So the papilla, you can kind of see, is just this tip part. The rest of it, the entirety, is the renal pyramid. So just the point or the top. And it's right here, not this part, but this part right here. You can see, especially in this section here, there's a dipping of the cortex. So the cortex kind of comes down as the same tissue that's coming down here in between the renal pyramids. That is called a renal column. Most of them you can see a little bit of column in here. Kind of the best one is right here. Also down over here is going to be another renal column. With kind of each column and a pyramid in the middle is going to be a lobe. So there is renal lobes. So there's 1, 2, 3, 4. There's usually around each pyramid. So there's about 8 of them. So we're going to talk about specific how urine's kind of formed coming up. So urine starts usually in the cortex, kind of in the medulla, and then leads down into this section, and then comes out this area right here. So these little cups right here, the smaller ones that are right here and here, these are called your minor calyx. Is a singular, calyces is plural. So this is a minor calyx. This is a minor calyx. This over here is a minor calyx, opened, and over here, and then down here. All of those are minor calyxes. So urine is produced and it eventually comes from the renal pyramid down to the renal papilla and then drains into the minor calyx. This right here and this little kind of it's opened up section here. So these two where the minor calyxes are coming, so minor is coming in here. This is a major calyx. So there is a superior, a middle, and inferior, but you can't really see it much on your model. So it's just going to be a major calyx right here and a major calyx over here. So major calyx, minor calyx, major, minor. All of the major calyxes and the minor drain into what we call the renal pelvis. So major calyx is here, and then you come down, and where it's kind of numbered right here is going to be your renal pyramid. The pyramid then leads down to this tube coming out here, which is going to be your ureter. So ureter, pyramid, major calyx, minor calyx. Just like we saw in the lungs, This section of the kidney here, where you see the blood vessels and the ureter entering the kidney, there's one area to enter because it is surrounded by a fibrous capsule. This is the hilum. So where everything is entering is the hilum, or the little indentation of the kidney. So now looking at blood circulation of the kidney. So we already learned this guy is the renal artery coming in. There's right and a left. But when it comes in and it divides, so division here and then division here. So renal artery divides into the segmental artery. So there's different segments right here and right here. Those segmental arteries then divide and kind of go up in between the pyramids. You can see coming up here, you can see coming up here. These are called your interlobar. Remember, it said each pyramid is basically a lobe. So these are between the pyramids and they're interlobar. So, see interlobar. So it goes from segmental to interlobar. Then you can see each of those blood vessels, especially this one, it starts to arch or go on the top or the base of the pyramid. So it goes in between the pyramid and then arches at the base of the pyramid. The arch or the arc of it is called your arcuate artery. So arcuate. Each one of these coming off of the arcuate is called a cortical radiate artery. So cortical radiate, which is going to then lead, you can see all of these bumps. These are each kind of showing nephrons, which is making the functional unit of the kidney, making urine. So we'll talk about those blood vessels coming up later. The vein side is the same thing. So this is going to be your cortical radiate vein. This is going to be your arcuate vein. And then you go, show you on this side, then you go here, and this is your interlobar vein. Now, the major difference between arteries and veins in the kidneys is there's no segmental vein. So the interlobar comes all the way down to go to the renal vein. Renal vein. So there is no segmental. That's the difference. So this is still interlobar coming down to the renal vein right here. So that's kind of the major part. Now we're going to look at a little more focused. Let me see. Focus on this guy. So this is going to be each one of these kind of pieces here, and this is going to go more kind of microscopic anatomy here. Each one of these is what we call a renal corpuscle, and it's going to have parts too. So you can see renal corpuscle, kind of little gumballs. Those enclose the blood vessels and enclose what we call the glomerulus, where filtration happens. So when you have a glomerulus, so this is just an opening. This is all renal corpuscle. This is actually just cutting in half and looking at it. So this tuft of capillaries, whether it's the red side or the pink side or the yellowy side, red side, yellow side, these are going to be the glomerulus. So it's a little tuft of capillaries that does the filtration. So this right here is the glomerular capsule. So it's holding in the glomerulus. It's a big capsule. You have an outer layer, which is this section here. And then you have a visceral layer, which is showing the yellow with the blue dots. the visceral layer is specifically made up of what we call podocytes. Podocytes are going to have little feet that are going to help with filtration as well. And we'll talk more about that in lecture. So that's a podocyte, and that's part of the visceral layer of the glomerular capsule. In between the outer layer and the inner layer, so technically over here, this space is considered the glomerular space or capsular space. Then we have the two vessels that are coming in. So this is branching off of your cortical radiate artery, and this is branching off. This is your afferent with an A. Afferent glomerular arteriole. So this is going to be able to dilate and constrict based on need. So this is the one coming in, and it's afferent, and you make the glomerulus. And then this one is the exiting one. So this is your efferent glomerular arteriole. The afferent is larger than the efferent. So that can be a way to see the difference. So this one's larger than the efferent, which is right here. So this is going to go to your paratubular capillaries, which are over here. So it comes off the cortical radiate artery, makes the glomerulus. Efferent arteriole goes to paratubular capillaries. Then here on this, and we'll go over it next too, you have the kind of tubule system of the nephron, which is the functional unit of the kidney. So this is actually called your distal convoluted tubule. And down here is going to be your proximal convoluted tubule. And I'll show you on the next one, more specific. So distal convoluted tubule, proximal convoluted tubule. So this is looking at specific parts of the nephron. So this is going to be a nephron. This is going to be a nephron. Both of them are nephrons. So you have the glomerular capsule. Glomerular capsule here. And then I showed you have part of the tubules. So here is going to be your proximal convoluted tubule. So it's the beginning part off of the glomerulus. The first part that urine's going in is called the proximal convoluted tubule. So this is the glomerulus. And so then right here is your proximal convoluted tubule. It's all the ones, if it's convoluted, it's kind of squiggly line. Then you go down here, and there's this part. Kind of make a U-turn. This is your nephron loop. So you might hear it's loop of Henle, but nephron loop. You have a descending side because you're going down, and then you make the U-turn, and you have an ascending side because you're going up. So descending and ascending. And you have a thick part of the descending, so thick part of the descending nephron or descending limb of the nephron loop. And then you have a thin part of the descending nephron loop as well, or limb. So entirety is nephron loop. You have descending limb and ascending limb. Once you go back up, then this part is called your distal convoluted tubule because you're farther away from the glomerulus. Even though you get closer, you have to go down the proximal, go down the nephron loop, and then you come back to the distal convoluted tubule. Even though it goes closely, kind of associated with it, and we saw it right here, it's still called distal. The distal convoluted tubule then comes in and connects to this part. So you can see this is kind of like a little tree branch where the distal convoluted tubule is coming into the collecting duct. So the collecting duct has a bunch of distal convoluted tubules coming in so it can start draining urine. Then Once you get to the renal, so you're in the renal pyramid, but now you're in the papillary area, so renal papilla. This is going to be your papillary duct. So all collecting ducts are going to come down and go into the papillary duct here. You can see on this that there are two different kind of lengths of nephron loops. So you have a cortical nephron, which is the nephron loop goes a little into the pyramid. And then you have a juxtamedullary nephron, which is going all the way down into deep into the renal pyramid. So you can see. So that's looking at the difference of those. You can also see, looking up here, capillary beds. So again, it's going to come in. So you can see this is going to be the afferent glomerular arteriole, make the glomerulus, and then it's going to come out and it's going to be so afferent, and then it's going to come out and be efferent. So it's coming off the cortical radiate artery, afferent, and then efferent. So you can see on this one, this is the afferent side because cortical radiate artery. And then it comes off and goes the efferent side into the peritubular capillaries. So these are going to be draining and then go, we already learned about vascular. So these are the peritubular capillaries. When you're down here in the renal pyramid, so more closer around the nephron loops, this is called the vasa recta. So it is still a capillary bed, it's just different from the peritubular. So these are the vasa recta. Same thing that we talked about with the vasculature. So this would be the interlobar artery. Then you have arcuate going to a cortical radiate, which leads to afferent, glomerular arteriole to glomerulus to efferent. So, and then kind of opposite, you have your peritubular capillaries goes to the cortical radiate vein, which is arcuate vein, and then interlobar vein. So you can kind of see that on there. Last little section. So you can see, still you can see a little bit better renal capsule. Then this is the hilum. So you can see same thing of looking at the cortex, the medulla, the renal pyramids, and the columns to minor calyxes, major renal pelvis to ureter. Now the ureter goes down and both sides goes down to the urinary bladder. Now this is showing you a male urinary bladder because this is actually the prostate, which we'll learn more about next week when we go over reproductive. So where we have the ureters and they enter in this section, you can see right here. So ureter enters here. And then on the other side over here. So they actually wrap around the back and come in down there. That is called your ureteral orifice. Sorry, I'm really bad at this. Ureteral orifice right here. Then we have this smooth muscle that's going to be all around the urinary bladder. It's called your detrusor muscle. It's smooth muscle that's going to help squeeze the bladder so that you can empty it. Just like what we saw in the stomach, we see all the wrinkles because this is going to be an organ of storage. So stomach partially storage. So they have wrinkles, which are called rugae when it's shrunken, and then it'll expand and stretch when it's full. So it's just allowing for kind of empty and then stretching. So each one of those is called a rugae. Down here where it's narrowing, so you have detrusor muscle, but then you have this section where it's kind of narrowing into the urinary bladder. That's the neck. And then we have what we call the trigon. So the trigon is going to be this section right here. You can see that number. So it's going to include the ureteral orifice on both sides and then the urethral opening. So everything is going to kind of drain to the trigon. So your ureteral orifice and then urethra. So two ureteral orifici, and then urethra makes three. So that's the trigon. Then when the detrusor muscle is going to be coming down, so right here next to your urethra, which is this, so this is going to extend and be towards the external environment. So surrounding the urethra is right here is your internal urethral sphincter. Your external is going to be something that you can't really see on the models, but there is an internal and external. So there is the smooth muscle that's involuntary control, and then there's the skeletal muscle that's going to be voluntary control, which is your external urethral sphincter. So that's going to be internal right here. Detrusor is kind of the rest of it. And then you have your trigon, your urethra, ureters, ureteral orifice. Rugae is all the parts of your bladder. So again, this is going to be prostate, which we'll go over when we go over the male reproductive system. If you have any questions, let me know. If not, I will see you next week.